All right. Hello, everyone. Thank you so much for joining us this morning. I want to just take a moment and acknowledge that I am currently living, working, playing on the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh Coast Salish people. I'm really excited to have Anita here this morning, and I'm just going to turn it right over to you, Anita. So thank you.
Okay, great. Thank you. Thank you so much for inviting me. You have a great lineup of speakers. I'm honored to be part of that group. And I just wanted to first just let everybody have a bit of a context. As you can see from my slide, I'm currently a professor at Trinity Western University in the School of Human Kinetics. But I have come through the ranks as athlete, coach, now a coach advisor and supporting coaches, and researching female athletes and women's cardiovascular health. So I have a bit of a mixed background over the years of how I got here, but I hope that I can tie in some things that'll be relevant to you as you think about the athlete, sort of the life course of the athlete, if you will. Okay. My land acknowledgement at Trinity Western is we're located on the traditional ancestral unceded territory of the Stolo people. And in Whistler, which is where I live, we are so grateful to be here on the unceded territory of the Lil'wat and Squamish peoples. So how I've sort of framed this presentation is I want to highlight that because we're talking about a lot of reproductive issues, this is about the female athlete, and we're looking at it from the points of view of whether it's health, performance, and just life. And so kind of like tying those in, because obviously nothing stops and just starts again once you're done being an athlete. Those things all intertwine. And I kind of, these three main themes are how I've structured it, where we first want to take a look at some issues that are relevant to many female athletes regarding menstruation and hormonal contraception. And then also, as we move into another stage of life that may, some females may engage in, is pregnancy and return to sport. And then, of course, there's the family and athletic career, which I'm highlighting coaches, but this is also, this return to sport with a family is also affecting many veteran athletes as well. So hopefully by kind of linking in some of the issues and then a little bit of science and then with some solutions, and these are real life solutions that are happening out there that we can feel good about where we're going, but also talk about what we need to do. So I wanted to first start just kind of highlighting why the emphasis on the female athlete. And of course, if we were watching the Olympics last year, we would have seen lots of headlines like this from CBC, where we're talking about women are dominating Canada's performance at the Olympics. Lots of great stories. As we know, there's been a lot of investment in female sport over the years, both in like all throughout North America and a lot of parts of the world. So that's been a very good news story. And funny enough, if you take a look at the past 3 Summer Olympic Games, both for Canada and the US rosters, they both carried more women than men, or if going to these games. Both, like I said, this is the 3 Summer Olympics. This is not the case for winter, but the Summer Olympics is always a larger contingent, and it's very interesting that this is a new trend that we've seen over the last 3 Olympic cycles. The other thing too is when we look away from that elite athlete and we think about ultra endurance and all the recreational sport people are getting involved in, whether it's weekend races, ultra marathons, things that are fun. In particular, I've focused a lot of our early research on ultra endurance, and there's a huge increase in participation of female athletes in ultra endurance types of events that, over the last 10 years, but especially even the last 20 years. So 20% increase over the last 25 years. And so we're seeing a lot more women getting involved in these types of events. And also what we're seeing, and this is not just for women, this is men as well, that we're seeing that the age of peak performance tends to be older actually in this group. And I think it's because some of the earlier sporting competition and engagement might be in some different sports, and that people transition to this ultra endurance later. But you can see that the winners or the peak performances are still happening a little bit later than we would think in the athlete's career. So these are all kind of things that are important for us to note as I kind of move through the presentation. So this increased participation, and then the age aspect. And even when we go back to something like the Olympics, we see that we also are seeing more longevity in female athletes sticking around in the Olympics and in many sports. And we see this, we've seen this in certain male sports as well, where because we have a lot of increased knowledge and training methods and just a lot of support that we didn't have before. And we see that, as you can see, this journalist Phil Hirsch had I have a quote from here that's sort of citing that we have these better techniques, but we're going to have to reset our parameters for this frequently. Now, the interesting thing that I'll talk about a little bit later is we don't really have them set very well for the female athlete, right? There's a lot more work that's been done in males, as I'll touch on. So, but it's really important to note that this is occurring. And when we say, why is there not a lot of research in the female athletes? Well, this comes back to the early days of medicine. And if you guys watch any period pieces on TV, you'll see that women were the inferior to men, and they were not allowed to make decisions, and also viewed as maybe less important or not as applicable for a lot of this groundbreaking work that they were doing at the time. So a lot of women were excluded from medical and science knowledge production. In sport, when we take a look at that, women were not suitable to participate or compete in sport. And if any of you know about Pierre de Coubertin, who founded the Olympics, sort of one of the fathers of the Olympic movement, in 1894, he said that women playing sports was against the laws of nature and the most unaesthetic sight human eyes could contemplate. So what a lovely quote, right? So women were only allowed to compete in events that were considered suitably decorative, such as archery. So it was obviously, you've probably read stories and heard of catalysts at the time of females saying, excuse me, females saying this is not okay. And there were those renegades trying to change that. In 1928, the women were allowed to compete in the 800 meters. And as you can imagine, they wanted to work just as hard, and there was a sprint finish, and many of them collapsed to the finish line, as they still do today. And it was determined to be a pitiful spectacle to see girls tumble down after the finish like dead sparrows. So it was really considered inappropriate for women to behave this way, and they viewed it as that, this is too strenuous for the frailty of the female frame. And so it really, interestingly, there was no more races longer than 200 meters at any Olympic Games until 1964. So it's when you start to put it down like this with a bit of a timeline, you start to think, wow, wow, it's hard to believe that it doesn't seem that long ago that was occurring. Many of us that would be, our grandparents would have been, living in that time. And it's quite interesting to imagine that as we have now. Things like even half-court basketball were limited until the 71-72 college season. 50 years ago, men tried to pull Catherine Switzer off the Boston Marathon course. You may have seen videos of that in some stories, but only men were allowed to run it at the time. And, she snuck in there and wanted to prove that she could do it. And so finally in 1980, it was the American College of Sports Medicine, which is one of the organizations that I'm a member of as a sport and exercise scientist. And they were the ones to finally, actively come out with a statement about that women should be able to compete in marathons, and that there was no conclusive scientific or medical evidence that long distance running is contraindicated for the healthy trained female athlete. And I mean, we've still come a long way from that. If you'd like to read more just on this type of thing, I've put the link to the story. It was in the Chicago Tribune. So it's fascinating when you start to piece together the Olympic history. And I have one of my students is doing some work. I'll show a little bit of that later, that on the female athlete. And as she found in her work too, that some of the statements were that females wouldn't be allowed to run or compete because their uterus might fall out. So very crazy thoughts and whether they were really founded in the reality of the time or whether it was excuses. But either way, thankfully, we're coming away from that. So given that there's been a lot of participation and an increase in participation in females and women in sport over the last, let's say 50 years maybe now, there's still a gap in the sport and exercise science research. And this was even, this is fairly recent even, that we can still see that when we compile what's been done to date, there's still, 66% of the work has still been done in males. And so we have a long way to go to still understand the female athlete. A lot of studies, when they did exclude females, what the reasons were cited to be, it was too complex. They wanted to avoid the hormonal variation of the menstrual cycle. And so there was a lot of justification for just using males. There also, in some cases too, depending on the studies, the males can take their shirts off and we can access, and put lots of devices on them, and much easier than we can with the females. So all of this is not considered acceptable reasons anymore. All of the funding agencies for research are mandating that we include both males and females in our research. And also mainly because there's a lot of work that's also showing us that some of the work that was done in the past, there are sex differences that were not identified through the research. And so even in things like medicine, medicine could be viewed as not effective, but yet it works for one sex, but does not for the other. But when you lump the data together, it looks like there's no effect. So it's really important that we start to realize that there is a difference in physiology, which is why I'll refer mostly in this presentation to females, because I am talking about the female reproductive issues mostly. So just to let you know kind of where I'm going just with my work that I'm doing right now. I'm not going to talk about all the data, but I'm really interested in the athlete's heart. And especially since females were participating so much later, so much of this area has been done in males. So I'm really interested in this healthy adaptation, this physiological adaptation of the heart to exercise. And this is both in recreational and like all the way through any exercising individuals. And also in the cases of where there's maybe maladaptions, adaptive processes, such as we see sometimes arrhythmias and things form in people over time, trying to get a better understanding of how that works. So a lot of my work, and I just wanted to highlight just a few things to prove that I'm putting my money where my mouth is here, is saying that, I very early on in my PhD determined that I recognized before the funding agencies mandated this, I recognized the lack of information in females. And so I started making sex differences a priority in my work. And so with prolonged strenuous exercise this is an example of the Fat Dog 100 that's done here in Manning Park in BC. Just the takeaway from this was I was really focusing on heart function here and saw no sex differences in this particular study cohort, which was interesting to note. So again, no differences in fatigue or any issues with the heart. And I also did some studies looking at very high intensity interval exercise, which we're using, obviously is used a lot in sport. It's also being used a lot more in clinical populations now too, and in interventions trying to promote people to exercise where they don't have to engage in very long duration exercise. And in this type of studies, I did note some sex differences, but interestingly in the females, it was more of in some cases, more of a favorable arterial response. And so nothing to, like I said, I don't want to go into the science here, but just again, really important that we keep highlighting things that we didn't know before. This is a new study we just did now too, where we found that your aerobic capacity, your fitness, your Vo2 Max is our indication of aerobic capacity, is related to heart size in both males and females, but also in the female size, there was a significant contribution to the large arteries to that fitness, which we didn't see in the males. So again, learning a little bit more about how important some of these adaptations to the cardiac structures and the vascular structures are to influencing how females perform. And then lastly, this was just another one where we were also looking at, okay, well, what about not only males and females, but what about this different effect across fitness? So in this study, we were able to look at inactive, normally healthy, active, and then endurance trained athletes and be able to tease out where there may be sex differences and in response to a training, so we can kind of group them more together. So with regards to gender, I just want to highlight that a little bit here, because when we talk about, some of what I'm doing on the physiological side is very much related to the those that were born female at sex, and then this is your genetic makeup, this is your phenotype, if you will. But it's really important that we also understand that a lot of that is also impacted by gender, and gender could be viewed as the roles, which is where I'm mostly focused on. What's the roles we play in society? So is it that typical, caregiver role that stays home, takes care of the kids, or has to deal with all of the family business, or etc.? Or are we talking about gender, how you identify, or is it your gender preference in terms of sexual identity? So those are very different terms and mean different things, but I want to just highlight that I'm mostly talking about the biological sex implications, but that we do know that even in things like some of our cardiovascular health parameters, that we do see things like even though both the males and females can have heart attacks, that we would see that the gender role that is often placed, and we call this the feminine gender role, which again can affect both males and females, but the more of a feminine gender role you take on, that it's more likely to have recurrent heart attacks after an initial heart attack, independent of sex. So we do know gender is very much an important factor here. So I just don't want you guys to think that I'm underscoring that. And then also we have a lot to learn as more athletes are starting to come out as transgender or transition. We really need to understand how that changes may affect their performance and their health. So there's lots to do here. So if we kind of go back to, okay, where was I going to go with this presentation initially? Well, let's look at the female athlete, that in terms of menstruation and hormonal contraception, because that's something that a lot of females will go through in their athletic career. And I just wanted to highlight, there's a lot of research that has been trying to look at this, and it's all been done on a very different, in different ways. But there is some evidence to suggest that, at different times of the menstrual cycle, where we have, and you can see from this diagram that you can find online, just different how the hormones change over time throughout their cycles. But in that the follicular phase, the 0 to 14 days of the start of a menstrual cycle, there's some evidence there's increased mood, alertness, and potentially energy levels. There is some evidence that there's some positive adaptations to strength and high intensity exercise, and also that there's alterations in joint laxity, which if you guys, many of you are coaches, may have read a lot about some studies looking at the phase of cycle and injuries in female athletes. So there's some evidence here to suggest that these things might be occurring here at the start of this phase. And when we look at the next phase, the luteal phase, here we're starting to think that potentially we might have some changes to peak power. We may have a little higher heart rate and breathing rate and body temperature. There's some suggestion there's increased muscle breakdown, which would indicate we'd have to really watch our protein intake and recovery. Potentially some indication of lower energy levels or an increased appetite. And then in our during menses, that potentially, obviously, as we know, you've probably heard this from female athletes, they may experience a high number of symptoms. It may not be that they may not be that motivated to train during this time, and it may disrupt their energy levels and sleep, which we know generally during this time exercise is beneficial. But when you're an athlete trying to perform at their best and you don't feel your best, that can often be problematic. So I'm highlighting some of the key things of some of the research is potentially suggesting, but we really don't have a good handle on this. There's not enough. There's also contradictory evidence. So I just wanted to kind of indicate that this is sort of where we're at so far. But there was just recently some new methodological guidelines that were published last year, saying that when we're working with women as participants, like, how should we consider the impact of these things and how are we going to study them? So for example, if we are studying athletes and we actually want to test the impact of the menstrual cycle, well, then we need to test it at 3 times during the month so that we can capture, and we need to have blood work, and we have to have a number of things to verify that we're at the right phase if we're going to link it back to hormones. So there's a lot of this type of stringent approach hasn't necessarily been done before. So this is sort of a new, a new kind of call to action to kind of get better science so that we can better understand this, both for the athletes and for the coaches that are interested. Now, sort of physiology aside, I wanted to bring up some of these female specific issues that and this is recent, and many of you would have heard this, that the recent discussion via Wimbledon, where finally the athletes are starting to speak up about their concern over wearing white, and how many of them have expressed fear of getting their period during the time that they may have to compete at this event. And so this is really great in one way, that it seems that athletes are speaking out more, using social media. They're feeling confident to be able to address things that they're now realizing maybe they should be able to say, and that people should be considering their health and concerns. And then here's another story that was talking about the same topic. And again, there was some athletes that are quoted at saying that they really, when they were doing the math and as you get closer to the competition, all of a sudden concerned that they may get their period while they're going to be at the event, and they'll just quickly go on the on hormonal contraception, on the pill, to make sure they don't get their period. And so, like, having to choose to kind of quickly alter and their sort of normal health choices, if we will, is kind of concerning, that they would have to go to that length without being some consideration of, is there anything else we can do for these females that are going to be competing and should be focused on their performance and not being worried and stressed. And a lot of them do comment on the stress that they endured during this time. And I think, let me see, I do have some quotes that, or some quotes that were stated in there that I thought was really interesting. And it's they say, if athletes didn't have to worry about their period, they'd be able to run better and hit harder. That was one female tennis player that said that, and they also, the idea of the mental stress during the tournament. And so, again, that's another concern that they're adding on top of their plate amongst the stress of the competing. So obviously there's some things here that we can do to consider, policy changes that can potentially support the athlete. And here's just a few more quotes. And this is what I was talking about the going on the pill to skip the period. So, and that's maybe one thing to sort of help the stress of, I'm not worried about having to bleed during the event, but what about you still have the symptoms of cramps and fatigue? And so we need to do a lot more research to understand how to support females during this so that it doesn't impact performance. And even if we're not talking about that elite athlete, the recreational athlete, just supporting them in their choices, because there are a lot of recreational athletes that are still making choices about things like hormonal contraception in order to support what they want to do. And so it's important that we understand this better. So that gets me to the topic just of hormonal contraception, because we're talking about it now here, obviously, when we're looking at it from a physiological point of view. This is the type of contraception that actually may impact the physiology, potentially performance, maybe not, but we're more worried about this, as opposed to the non-hormonal methods are just, whether they're barriers or other sort of, or copper or other methods, they're not necessarily changing your physiology. So we're just going to focus here on the hormonal contraception. And I just want to highlight my student right now, Allison Campbell, who's working on, she just did a study and going to continue doing more work on hormonal contraception in female athletes. And the one thing she found in this particular study is we realized, just anecdotally, we kind of thought, a lot of the research, even if it is looking at hormonal contraception, is very focused on the birth control pill. And we thought, well, are the numbers of pill users still the same as they used to be? And so we did a large survey that we were doing actually in a lot of females across the country to look at various things. And part of it, we were really focused on the hormonal contraceptive use. And so her data she just presented recently showed that there still is the majority, probably 57%, females are using oral contraceptives, but then there's a whole host of others, such as hormonal IUD, implants, injections, ring, and patch. And interesting though, of the oral contraceptives, 43% of the females that answered the survey didn't know what type they were on. So it was a bit shocking to us. I think that they didn't know whether it was monophasic, diphasic, triphasic, or if they just even knew the name. So we understand that not everybody understands the mechanism of action or understands the exact formulation, but they didn't really have an idea of what they were taking or what it was potentially doing. The other thing I wanted to highlight is just quickly we wanted to look at to see if the type of contraceptive use differed amongst non-exercisers, exercisers, and athletes. And it typically was pretty similar. But the study also didn't have as many that identified as athletes. Many of them did identify as regular exercisers, but we didn't have a large cohort of athletes relative to the overall sample. So we are doing this again. A new survey is going to be coming out this year for female athletes in BC and throughout Canada, where we're going to be addressing this a little bit more in that population. But another thing that was neat about it, you can see the sample overall was we had like over 2,000 females that answered the survey. But the other thing that was interesting here is, I'll highlight in this red box, is if we look at the very right, there's, you'll see at the top, it says Black et al. 2009. That was the last study that was done looking at hormonal contraceptive use in Canada, and, oral contraceptives, etc. And one of the biggest changes we see was the huge increase in IUD. It's now at 28.4% compared to 2% in 2009. So, and the others have gone up as well, the ring, the patch, implant, and injection, but the hormonal IUD is probably the largest change. And yet we still do have a lot of oral contraceptive use, so pill users. So I think we thought that was super interesting, and it's something that we're going to have to address in our studies going forward, is making sure that we're not just controlling for who's on the pill, but what type of hormonal contraception are they on, so we can better understand the effects for females and athletes. All right, now looking to sort of another female reproductive issue that comes across and is becoming a little bit more supported is the female athlete that wants to get pregnant. So the interesting, I'll first throw at you a few different anecdotes or stories, and just to show you the extremes that some women go to just because they don't feel that it's limiting them. This is just a woman, Caroline George, who's a 42-year-old mountain guide, and this is her the day before she went into labor. Went up with her mother and herself, and so this was considered 3 generations with the new baby on the way. And then after she gave birth, a few months later, she was back at work just because and she doing things like breast pump packed in her climbing gear. So showing you about the thought that they want to do this, they want to have children, they want to start a family, but it shouldn't stop you from reaching or accomplishing your dreams. And in terms of some of the elite athletes that we've seen at Olympic Games, we know that Martina Valensapina won the bronze in Sochi, and she was at the time pregnant with twins. And the U.S. volleyball star Carrie Walsh, she's had a few children and been able to continue her sport career, and still won the gold medal in 2012 after her third. So I think really great examples. I mean, we do know these are elite athletes, and they are, again, not always the norm of what everybody can accomplish. But I think showing that it doesn't need to be the end of your career. Another athlete, Canadian athlete, when the other thing that comes up for them is they're looking for guidance. So when they decide, hey, I do think I can make this happen, I decide I decide, or I do get pregnant, but the idea of what should you be doing, or could you still be doing while you're pregnant, for female athletes is very much a bit of a gray area. So they want to continue training so they don't detrain too much while they're off their sport if they're planning to return, but they also don't want to harm their child. So there's a lot of questions about how much is acceptable, and a lot of them feel that they don't necessarily know that they have the right guidance there. Another two, Megan Mickelson, female hockey player, as you might know. She has had two children now, and felt the first time felt very obligated to rush back to getting back into competitive shape and get back into the next championships and games. And after the second child, said that even though she gave herself more time, which was 3 months, it's not a lot of time, but she gave herself more time. It was hard. It felt like it was too much time at first, but she knew that she needed to do this and to take care of herself, and trying to really take it slow and progress back. And so I think we see that female athletes are trying to figure it out, and they're finding ways to figure it out. And Catherine Pendrell is our Canadian mountain bike racer. They were interviewing her and talking about how she ended up taking it 1.5 years off racing, which wasn't her initial plan. She thought she was going to have a family and then kind of jump back in because of the Olympics. But when the Olympics got postponed, it ended up giving her more time, which potentially in the end was okay. I think it was good for her, but she still was coming back fairly quickly after giving birth. And so, I think what she says she's been quoted to say is that, doing it then, wasn't sure if it was the right time. And a lot of athletes struggle with this, but yet you don't know if it's going to happen or when it's going to happen. And should you be putting your whole life on hold, even though you do have these dreams of competition and sport. So I think it's a really good way you can see the struggle that a lot of the female athletes have. And and so it's something that we need to be able to support. In the research, what does the science say just about this? Looking retrospectively at elite athletes compared to just regular exercisers, which we're calling controls. The research has shown that the most athletes reported their performance level to be the same or better in the postpartum period. And most controls reported their exercise performance was the same also. So many of the exercisers, people that go back to exercise in the postpartum period, feel that they can get back into it and they feel good again. So there's no reason why female athletes shouldn't be supported in doing so. And I'm just going to show you 2 slides of some of the data, but I think what was interesting is you can see all the athlete data is on the left with the higher bars, and then the controls are on the right. So this is how much endurance training per week they're doing. And so of course the athletes are doing a lot more, but the black bar is the pre-pregnancy. I don't know if you can see my cursor, but the pre-pregnancy here on the left. And you can see that they do the first trimester and second trimester. They make some adjustments to the third trimester up and down about their training volume. And then initially postpartum at 0 to 3 months is probably their lowest for the group. But then within 3 to 9 months there, you see you see the increase come back up to pre-pregnancy levels. And so, and we see this with the controls as well. So again, these are non-athlete, but exercising females. And so it's the females are determining what might be right for them and what they can do. And of course, this needs to be driven by, medical guidance to make sure they're safe to do so. But they have been able to, in a very, reasonable amount of time, get back to their training volume that they were doing before. And this is the same, I just want to show you, this is the strength training. It's the same pattern that we see. So not just endurance training. So they're getting back to their volumes of training. And because all these individuals are exercising females, I'm sure that just as they did before, they found ways to do this. It was important to them, and they're doing so now. And obviously we don't necessarily see this with sort of non-regular exercisers. We have lots to do in helping the non-exerciser. There's other studies that have taken a look at, like case studies, where we've taken this an example of an elite runner. And again, like looking at, if we just look at the very top line, that's the oxygen consumption, or Vo2 Max, which is one of the indicators of their fitness. And you can see it didn't really fluctuate that much in that postpartum period. It's been pretty steady, but yet some of the other thresholds and training factors did increase again over time as they were able to do more training. So these female athletes are not necessarily losing a lot of their fitness. And I actually have a student right now that's looking into the postpartum period of athletes to see if they actually, because of the increased blood volume of carrying a life and having this extra blood volume in the body, that maybe that also is a time to really piggyback off of that in the postpartum period. And do we see, is that one of the reasons why female athletes are able to bounce back so quickly? Back to policy again, in terms of this case here, if any of you have read about Hilary Stellingworth here in Victoria, she was an example of with Athletics Canada of an athlete who had used one of her cards, if you will, to have her first child, and then later got injured and normally would be on sort of that injury reserve again and needed another. So basically to be able to keep your carding, like to allow to keep getting paid and supported while you're off on injury. And at the time it was considerable, you only allowed one of those in your career. And so she had to fight to sort of consider that pregnancy is not an injury, and it's something that we will do, and they deserve that time and should be supported throughout that. So a lot of athletes lobbying for the support of still being able to support themselves, pay the bills, and do everything even when they go through pregnancy, just as they do when they're injured, but they're not injured. We also see the other Kim Goucher from the Canadian basketball. You guys would have heard about that in the news, all about that she wasn't able to bring her breastfeeding son to Tokyo. So she was almost not going to be going to the games. And so luckily with pressure, that was overturned. And I'm sure this affected other athletes as well, that we obviously are tuned into our Canadian athletes, but it was such a strong message to be able to find ways that this shouldn't be an option. It's not. We understand there was a pandemic and there was situations in place, but this was a very important component for her. And then, Paula Radcliffe, many of you know, is the British runner who's very famously won many marathons. And the 2007 in particular, she won the New York City Marathon at 10 months after giving birth to her daughter, and repeated the victory the next year after. So a lot of great evidence from supporting the fact that these athletes can do this and should be supported in doing so. So this kind of transitions where I'm just going to be finishing up here soon just so that we can get to some questions, but this transitions nicely into the coach role, because again, the return to sport for female athletes, this is very much what coaches go through when they might have adjustments. They also want to start families, and what happens to your career, like as a coach, as you transition here. That's a picture of me when I was working with the Canadian Freestyle team. I was a coach that was traveling through Europe, and that year I got pregnant, and I remember leading up to thinking about starting a family with my husband, and we were talking about it in quadrennials and cycles, and I wasn't even the athlete, but it was because I was on the support team and a coach that I wanted to be able to support the program and make sure that my interruptions didn't affect them. So it's kind of interesting how as coaches you worry about that too. And and I kept the pregnancy quiet for probably about half of it until I told them about it. And then after that, it was recommended that I maybe shouldn't continue traveling with the team. And then also it was just assumed that after that, there would be new people that would take over my role because I wouldn't be able to fulfill the role. In hindsight, I had a lot of other things I wanted to do, and that was okay. But I think when I look back, I just think it would have been nice if there had been a discussion with me and more about, it was all very cordial. They think they were doing the best for me, but I just wonder sometimes if they know that I might have liked to have talked about it and see if there was a way I could have continued in that role. The pressure to show that it doesn't matter and that you can do it is a great example. Danny Sinclair, a University of Victoria basketball coach, where she, after giving birth, basically forced the doctor to discharge her the next day so she could show up and be on the bench the next day for a very important game. And again, having her husband in the stands, supporting her with the infant. But just an example, she talks a lot about this in this story, just about that, you feel like crap then the next day after that, but you've got this this fear that you need to do that, and you need to prove that no, being a female coach and a mother is not going to impact my ability to do my job. And so a lot of us feel that way. That happens to women and any of those that take on the caregiver role and take care of the infants. That everybody feels that way in business and in various careers. So I know this isn't exclusive to sport. A great example of how things can work is the example of Katie Kalinsky in the US. She was assistant coach at the time that she got pregnant with the Lafayette College women's basketball team. She at the time had been making such a great move in her career, not only working within female basketball, but also with the men's program. And so this was a big deal that when she got pregnant, which was by accident, she was really concerned about her career and how people would view her ability to do that. And so a great thing is the head coach at the time was really supportive, and I'll talk a little bit on the next slide, but she says, when you're in sport, people feel like you need to be giving yourself 100% and everything's so pressure and jam-packed. And so this assumption that we wouldn't be able to be successful coaches, you have to prioritize that. If you're a mother, you have two priorities. So what's it going to be? That's sort of the feeling that they have. And so her coach, her boss, essentially, Kia Damon Olson, when she was told about it, she was like, sure, that's fine, great, good, congratulations, good luck. And she, which wasn't what Katie expected. And Kia does not have children herself, but she was very open-minded about it and said, you know what, she could see that it's women are capable. And the one thing that the article, I think that I've got listed on that prior slide that if you want to look into, is that the importance of female role models, because Kia had worked before that for another female coach who had a couple children. And so I think she could see that it was doable. So even though she didn't have children herself, that those role models are so important for all of us to be able to see how it's possible. And I'll just go back to that slide for just 1 minute, but just as a way, the clincher is for many of these women is trying to figure out what's going to work for them. Is this what I want to do? Is this what I would like? And how can I do it? And then of course you have that support system and those people around you that are making it possible. And so I think whether we have as fellow athletes and coaches, like females, whatever stage they're in, if we can make sure that they're well supported and can be listened to, that's really important. So that's sort of where I want to summarize. And that gets back to my title about it's not that complicated. I think we do need to understand a lot more about the female physiology. And as I mentioned too, as we go forward more with the transgender physiology in sport and how it affects not only our performance, but long-term health, but particularly for those females or those who are transitioning, that whatever the hormonal fluctuations and aspects, or those who get pregnant, how can we best listen to them and support them in what they need? And then one of the big ways too is we need to advocate not only for them internally, but for and support policies and things that need to go through that will support them through their career. So with that, I'd like to thank Amy and Athlete Transitions for having me, and just open it up for any questions.
Thank you so much, Anita. It's such an important topic, and one I don't think we talk about enough. I want to just quickly, I have a couple questions written down. I don't know where to start. I want to touch on the Wimbledon thing. And I think so many people don't think about that aspect of the stress and the fear that has on the athlete, and how such a normal bodily function is causing this extra level of stress that other athletes don't necessarily need to deal with. So I'm really glad you talked on that policy change, because it's such an unfair thing that as women that we have to have that added fear or added stress.
Yeah. And what's funny is we look at it from, obviously in this case, from the menstruation side, but I know I've heard even the male athletes talk about things like, even in their own situation of sweat and perspiration and things, the whites turning yellow and embarrassment even on their end, right? So it's like it goes even beyond the females, but I think in particular, it's not something that a female athlete wants forever in their pictures or on video, right? So
yeah, well, even as you were talking about that, I was also thinking about the swimmers, and I'm like, I just can't even imagine what they go through.
Yeah.
And then having to make that difficult decision of like, am I going to put something in my body in order to just avoid this, right? Like, a factor of like,
Yeah.
it removes some choice that we don't even think about on a day-to-day basis.
Yeah, absolutely.
Which kind of brings me to my question of, for athletes, do you have recommendations on menstrual trackers, or what the best way that they can be tracking their own cycles are?
Yeah, there are some out there, and I think that, I do have one that I could send you later, a link to, that I know has a lot of like research and science behind it. But I think in general, really, it is just tracking, right? So whether it's through an app, or if somebody wants to just, keep a calendar near their bed to just kind of remind themselves. But I think one of the trackers, because the timing, even if we look at like the research we're going to be doing with these athletes coming up, is the cycle, even how you move through a cycle will change from month to month as well. So it's not set. So even though we could count days, or we could track temperature, the next month it could be a little bit different. So it is kind of maybe really just getting used to, I think most importantly, listening to your body and understanding wherein those changes are. There's a lot of women that are really tuned into their bodies. And so so I don't have any one tracker I would recommend, but I do know there are some out there that include like comes with a thermometer, and like, so you can track your temperature and stuff. And there are ones that are also being developed for fertility tracking that could also be used for, like, they would have a similar purpose, right? Just for different outcomes. So there are a number of those, and there's some in development as well that I know of. So yeah, so I think it's potentially an option, but
Okay. And that kind of brings to my next question is there research, or is there research that of that's planned around like how to, I guess, maximize performance in the different stages? Because you highlighted the changes that can occur, which then makes me go, why don't we research it and figure out like how best to support and enhance performance in the different stages?
Yeah, no, absolutely. And I think that's kind of why the recommendations came out, is the research is a bit contradictory, I should say. And I think the reason is the methodologies have been so different, and how we are saying that an athlete's in the follicular phase versus the luteal phase over time has, maybe sometimes it's been just athlete recall, like, oh, how many days into your cycle are you? And if they said, 11, then we would say, okay, for sure, you're in your follicular phase. But they're really recommending now that we have a better sense of if we're going to say that this is what happens to performance, we really need to know what has then occurred through the cycle and with the hormones, and then be able to say that, yes, when your, hormones do this, at this time, you may experience this. But I think the jury is still sort of saying that we can't say that the evidence is that clear on that yet. But I think, and then there are some that suggest that even if that is measured, it's not always that significant, that an athlete may not experience that. I think it sounds like the largest concern for athletes at this point is the actual, when they're in menses and the symptoms associated with it, or right before, that seems to be a bigger barrier to their performance than anything. So obviously finding ways for us to make that most comfortable for the athlete, which is probably why we think it seems that a lot more female athletes are going on the hormonal IUD, is because then it's and there's a lot of, I think, sports medicine physicians that are suggesting that if that's what they want, so they don't have to think about it. And then when you're on those long acting hormonal contraceptions method, or whatever, whether it's the ring or that, they keep your hormones constant, so the athletes wouldn't feel that fluctuation. So if that's really important to an athlete, then that may be a choice, but they need to go get information and learn about it, right? And that kind of thing. I feel that's maybe where it's not quite clear yet and this is probably for females everywhere, not just athletes. They really don't necessarily understand about it, and may just go on what their friends on, or maybe their doctor prescribes something, but have they really chatted about it and talked about it? So something we're advocating for is to just get a little more information and then make sure it's the right. But some athletes prefer the short acting methods like the pill, because then whenever they choose to change, they can immediately stop taking it, and it's a lot more in their control than the long acting methods. So again, depending on what they're aiming to do.
That also then brought up a question around like, with the contraceptive, is there any concern with doping or with, like, do they need to be reporting that they're on this? Because I know, like, you take certain, like, you have asthma, you actually have to report that medication. So if a female is on a hormonal contraceptive, is there reporting that needs to go on?
No, so far there's nothing that's been identified as an ergogenic aid in that regard that has been, yeah. So I mean, sure, with their, if the team or the athlete has access to like their own medical, practitioner through the team or the sport, like hopefully they're providing that information. There's just general health risks with hormonal contraception, as we know things about potential increase of blood clots or issues. There is an increased risk of stroke for certain people. So there'd be people that would want to know if they're at risk for that. But in general, as far as ergogenic aids, no.
Okay. So then I have one last question, and that's kind of going back to actually your personal research. And how do you see, like, your heart-based research impacting athlete training, or specifically female athlete training? Or do you know at this point?
Yeah, well, that's exactly it. We've anecdotally heard some things from some of the athletes. So but most of them talk more about injury, like where they just feel off or they just feel like their joints are loose. Like you hear some athletes talk like that. We don't really think that they're aware of any specific issues or changes to their cardiovascular system. I don't know that they recognize that, things like their heart rate or breathing might be a little bit higher unless they're constantly exercising or tracking with a heart rate monitor. They might notice that, but I think it's very subtle. And so I think for us, I think what we're trying to do is almost clarify some things. I mean, we do know the hormones are involved in things like particularly with our artery health, and that's why we think women are protected for so long in their life until they go through menopause, and then they lose those hormones are definitely related to their cardiovascular or cardioprotection, we call it, and their cardiovascular health. So I think I think it's more of a long-term understanding of what's happening. I don't think we're going to see that there's any major changes. I also think if we do find that some things are altered when we do the research, that there'll be some compensation elsewhere. So I don't think we're going to see in the end big changes in performance or things like cardiac output, like your ability to get the blood to the working muscles. I think all of that will end up being maintained. It might look a little different through the cycles. I mean, that's what we're hypothesizing.
Okay. I'm trying to think. Oh, we have a Q&A question. Here we go.
Oh, I just saw that come in here too. Yeah.
Okay. Okay, I'm just going to read it because it's not actually a question, but I think it is interesting. It says, such an interesting conversation, especially with Roe versus Wade being overturned in the US. Tracking cycles is extremely personal and requires very high level of trust with staff to ensure that athletes' privacy is protected. As well, many athletes require birth control options to manage heavy cycles and complications with low iron. So again, yeah, privacy. And I think that's an important one because I know, especially looking at Roe versus Wade, they are talking about the tracking that occurs within those apps, like the outside tracking, not the actual physical tracking, and how there is privacy implications there.
Yeah, that is such a great question or comment, I should say, because that's the one thing that's a little bit different here in Canada is the access to information is a little bit different. So we have a lot more like security about certain things, whereas like, for example, just as researchers, we can't host any of our participant data in the States. It has to be hosted in Canada, because in the US, they have laws where they can just go in and take that data if they want it. Like they can use that, so it's a little bit different. And I can see that being a concern for US citizens and athletes for sure. And, even here in Canada, like, yes, athletes are going to be concerned about maybe they don't want people to know, or they're nervous what people think. But I think we're starting to see, and again, I'm not sure if it's the social media influence or not, but I think we're starting to see athletes talk more openly about this type of thing. So, I mean, hopefully here in Canada, at least, that it's very understood. And that's one of the reasons why in our survey we did with the females that we did across Canada, we just asked about hormonal contraceptive use, period. We didn't care about what was the reason. Whereas some studies will specifically take females that are using it for the purpose of contraception and then study the effects on their health or other outcomes. And so we're really interested in like, hey, no matter why you're taking it, acne, to control your cycles, or as a prevent pregnancy, it still is, because it's hormonal, is still going to affect your physiology in some way. So we're interested more in that and less about why. So yeah, but yeah, super interesting topic.
Yeah, I think it is very interesting. Just one more thing before we get wrapped up, and I don't know if I'm right, but I'm feeling like there things around pregnancy are becoming more acceptable, and we are seeing, and maybe that's because there's more women that are just open about it. But I'm wondering, do you think the same thing? Do you think it's getting more acceptable that women are getting pregnant and returning to sport? Like, is that your experience?
Well, yeah, I feel that it's really in the last 2 years become a very hot topic. So I'm not sure that every athlete still feels that they can just go ahead and do it. And they're not, and I don't think it's all just about the sport or the organization that they wouldn't support them. I think they still are very nervous about, can I do that? Right? If I go do this, can I come back? Right? So there's the self-doubt and so a lot of these other athletes, I think, serve as good role models for them. But there is still that fear, because I think, and I think the more we have those role models, the more women may feel supported in doing that. But it is still, I think and just like I said, I mean, we have that in a lot of fields as well, like a lot of business where you might have this crazy career and you're on track for certain promotion, and all of a sudden you say, hey, I'm pregnant, I'm going to be off for a year or more. Then what does that do? People are afraid of their promotion. And I do think it's also important this is a good time to highlight that a lot of, whether they're same-sex couples, like somebody is the caregiver. It's not just females in that case for those things, but somebody wants to stay home and be there and has to nurture the child. So, there's a lot of stories out there about older stories too, about female athletes who had to choose and thought for the future of their family and career, they had to stay focused on their sport, and some of them were very far away from their children, and their children were being raised by other family members. And they talk about, in hindsight now that they're older, that they're so upset that they did that. Like they feel I'm a bad mother, so there's still, I think, a long way to go. We need to find, and that's why I talk about the solutions. Like, there are people doing it. It is working for some people. The basketball coach I was talking about, Katie, they had a pack and play in the basketball office, and different people would support so that she could still breastfeed and coach and things like that. I mean, so there are things that can be done, but it takes the willingness of the participant, and then also the support structure around them is so important. So but I think we're going to see this topic continue to be important.
Yeah, and I think that's such a great point about the need for the support structure, both within the sport and at home, because it is an important, huge part. Thank you so much. I am excited to see where your research goes, and I will be following along. So thank you.
Well, thank you so much for inviting me. I look forward to hearing the rest of the talks. Bye.